Elizabeth?
Yes.
Hi, can you hear?
Yes, proper. I can hear you.
Okay. So just quick for the for your next slide, you can just tell us next, and we'll click the next slide for you. Yeah.
Okay.
Okay.
Okay. I think
Oh, yeah, she's here.
so. So how do we start in this?
Today we are here to talk about the tools that would be supporting utilities, regulators to design and operationalize safe, inclusive, and sustainable service model in sanitation. Along with the SROs, Athena Infonomics and FSMA are here together to present this to you. And I would the broad agenda for the day is going to be the introduction to all of us, setting up the context, and looking into how SRWAS is looking into the regulatory roles in sanitation service delivery. And then we would be moving on to how the assessment tools and the planning tools come together. And we would be doing a quick walkthrough, and if you're interested, you would be doing a detailed walkthrough later on at that point of time, and we would also open the floor for questions and answers. And I have with me my colleague, Eva. So before that, I have also Elizabeth Nahima joining us online, and she is a research and knowledge management specialist from SRWAS Regulators Association. And SRWAS is a network of water supply and sanitation regulators from the Eastern and Southern African region, and they are cooperating the effective WSS regulation through either capacity building and information sharing across these regions. And Eva Mary is a WASH specialist at Fecal Sludge Management Alliance, and it's a member-based network to support organizations and individuals working in FSM. And finally, it's me, Mitra, principal consultant at Athena Infonomics. And Athena Infonomics is an impact solution group that applies social science research, data, and analytics to advance global development. So I welcome you all, and so we would be starting with Elizabeth setting the stage in terms of the regulatory framework and the guidelines that she is working on. So over to you, Elizabeth.
Thank you, Mitra, for this great introduction. Now we are going to share about the framework that SRWAS has developed to support the implementation of inclusive sanitation in urban settings. The current situation is that based on SRWAS regional benchmarking report, the average water service coverage is at 78.5%, while the average sewerage coverage is at 20%, meaning that around 80% of the population in the region rely on on-site sanitation system. The sanitation services has been characterized by a number of challenges, including fragmented institution setup with no clear responsibilities about who is doing what, the multiple actors. This in itself is not an issue, but there is a lack of proper coordination of different stakeholders engaged in the intervention. We also have a problem of illegal dumping of emptied sludge, fecal sludge in open places, resulting into pollution of environment, and with weak enforcement. Unregulated price is another issue, and it is very difficult to predict the affordability of everyone who is in need of the service. We also have a lack of quality standards, and the consumer do not have anything to base on in claiming the quality of service. And also the lack of adequate and sufficient investment in the sector, leading to investment being geared towards infrastructure of sewer sanitation that serve a small portion of the population. All these together lead to inadequate services which also reach a few and a small portion of the population. SRWAS recognizes that effective inclusive sanitation play a significant role in sanitation service provision, and it needs to address the following question: who is responsible for what service outcome? How are they held accountable for that responsibility? And how those responsible are resourced to plan and manage their responsibility across the sanitation service value chain. Next, please. So to change that situation, SOAS has developed inclusive urban sanitation regulation framework, which highlight different responsible institutions at different levels. At policy level, we believe that the ministry responsible for water and or sanitation has to formulate adequate policy for sanitation service provision and monitor its implementation. At regulation, the framework recommends that there should be a regulator specifically for water supply and sanitation, including on-site sanitation and fecal sludge management. At service level, we have two different types or two different levels of service providers. The framework recommends that the utilities in charge of water supply and sanitation take the overall responsibilities of service provision. However, the framework gives rooms to possibility of delegating certain services to private sector, like private operators, CBOs, or municipalities. So this is the setup that the framework has put in place to help our members to implement inclusive urban sanitation. Along that framework, we have developed guidelines and tools, including citywide inclusive sanitation planning guidelines, guidelines on sanitation service tariff settings, and inclusive sanitation service provision and service delivery arrangement guidelines, all this to support and to help our SOAS members to implement the citywide inclusive sanitation. Next, please. When we talk about citywide inclusive sanitation, we mean a 2x3 matrix which provide a framework from inclusive sanitation service delivery planning, where we have service outcomes, and we expect the plan to consider to ensure equitable service levels at affordable cost for everyone, including the poor and vulnerable groups. We are also looking at safe services, where the plan have to ensure citywide safe management of waste that covers the entire service chain. And the sustainability. The plans have to evaluate and ensure the financial health of service provider in a long-term run. When we talk about system function, to be able to achieve citywide inclusive sanitation, our plans have to consider responsibility, highlight the gaps, overlaps, and ambiguities in legal mandates of different institutions involved in sanitation service provision, to establish clear roles and responsibilities, who is doing what. Then comes accountability in the service provision. What are the measures? What are the mechanisms to ensure the accountability throughout the service provision? And the plans should set up the monitoring and evaluation component to plan how we are doing in achieving the planned outcome and push for data transparency. Then comes the resource management and planning. How the available resources are allocated to different components and systems of sanitation, and have practical resourcing plan that fully evaluate the investment capex and operation and maintenance cost of proposed interventions and revenue sources. Next, please. So to be able to achieve citywide inclusive sanitation, we need to assess and plan properly. And there are available tools that helps to achieve that. So now I would like to invite my colleague Eva Mary to walk us through the assessment and planning tools for effective, inclusive sanitation service delivery, where we change the focus from infrastructure to service delivery. Thank you.
Thank you, Elizabeth. So she talked about the plan, how these are the main steps, the 6 steps of the planning, a good planning tool that exists. So what are the actions that come up with? We have detailed it here. And how do we achieve these actions through the questions that arise to do these planning actions involve? Where do the utilities stand in terms of sanitation service level, the gaps that exist in the value chain, how are the poor and vulnerable served, and also the question about the targeting the scarce resource that is the public resource that is available for the utility. And so we have classified that these groups of questions can be answered through 2 different types of tools. The first one being an assessment tool, and the other one is a planning set of tools. And in today's session, we're going to talk about what each of them are, that both and how they will help us achieve CWISE for a particular region. So to move from infrastructure-based plans to a service delivery-oriented planning, we have classified that the assessment tools that include SFT, an Equiser tool, and CSDA will answer most of the questions that the utility might have in terms of the gap, the accessibility to the vulnerable and poor to the public services that is offered, and also funding. The funding resource allocation could be answered through the planning tools that includes the infrastructure planning, the business model selection, and how to utilize those finances equitably using the Equiser tool. So for today's case, we're going to take a city A and work through using these tools. We're going to work through a plan for the city A. And so here we're going to set the stage. The city is located in East Africa. It has rivers nearby. It has low-income household of 30%, population growth of 5%, and also it has some data about the sanitation, water and sanitation situation of that city. And how do we now apply this for the city? How do we go from taking it from the current status to ensure that it is meeting the SDGs and also meeting the needs of the people? So here we're going to apply the set tools, and as an outcome, we're going to get advocacy tool from SFT that involves a pictorial representation of the fecal flow in the city, and then from the CSDA, we're going to have a checklist of the action plans that need to be taken, the immediate action plans, as well as the ones that could be like midterm and long-term goal. From the Equiser tool, we're going to have indicators in terms of equity, safety, and sustainability for the set projects. From infrastructure planning tool, we're going to have suitable infrastructure that is needed for the said locality based on the conditions that is locally present, and also selecting a business model that is currently present to evaluate which is the best suitable one for the particular city. Okay, so we're going to start with the assessment of the city A. To make it easier, just a quick housekeeping for those who are joining us online, that you can enter your questions on the chat. We're going to take a Q&A at the end. So yeah, to make it easier, going back to the assessment, we have made already entered the data for this city on our web platform on the tool, and just going to showcase this as a video. So the tool already has in broad video guiding you to how to use it. But so when we start with the SFD, that is the shed flow diagram, we start with entering in the city information, and we enter the data along the value chain as is available for the city. So here we have entered what is the current population, which is the most important, and the city information, and also details about where the city is located. Then we start entering what along the value chain, what is the status, where it is, how safely it is managed in different aspects, and how much percentage of the fecal matter is safely contained and how much of it is not safely contained. And while entering this data, we also enter some assumptions of like how much of the percentage of the containment unit is filled with sludge, how much if it is supernatant. So those are very locally relevant data. Those could be edited. And once you enter the different percentages of the fecal matter flowing through the value chain, you arrive at and identifying what is the balance level of each of the containment or each of the services along the value chain, how much of it is properly in green or safely managed, and how much of it is not. And so once that is the data you enter for the quick SFD that we are doing here. I'm showing in this video all the different types of questions that you might need to enter for this particular city A. We have identified that the treatment to the wastewater plants is only 25% if it is going into different types of treatment plants. And here, along with doing a SFD, that is a shed flow diagram, we are also analyzing what is the enabling environment around it that helps, that is leading to the current situation, the current status quo of the sanitation situation. So it's like, since the current city A also has a sewer line and a non-sewer line. So we are now looking at along the 3 pillars, that is the enabling, developing, and sustaining, the different questions, and on the 3-point scale, that is in the policy, planning, and inclusion, under enabling, developing, funding, capacity building, and outreach and inclusion, and others. So what is the status? So based on that, we arrive at, I'm going to skip through quickly. Oh, I can't skip. Excuse me. Okay, so based on this, we arrive at SFD and a CSDA for the city that could be seen. Sorry. I have to go. Can you show me the video where it is open? Yeah. Right. Yes, you do the same for also the non-sewered aspect of the systems that is there present for City A, answering the questions in terms of in the 3-point scale for along the value chain for all the 3 pillars that we have, and you arrive at the SFD for City A that looks like this. I'm gonna pause. So here you can see the most of the on-site sanitation is not being safely contained or managed. It's not only 7% of it is going to treatment, like safely. And in the off-site sanitation systems that includes the sewer, there is only 14% that is emptied and transported, and among even the 14%, only 11% of it is not treated. And the rest is only contained but not empty. That means it is covered up and they dig up a new empty pit or containment system and use that. So that is the status of City A. And also then we get the CSDA report that gives what the enabling conditions that lead to this situation for City A. And here it comes out as a report that includes what are the conditions that are there for sewer sanitation and what are non-sewer. You might see in sewer some of the enabling environment were green, and for non-sewer, many were red. So the action items that need to be taken urgently were more in the non-sewer aspect of for the city A. Right, and the color codes also depict in how to, what action items need to be taken urgently for under each of the pillars, and then what could be a midterm to long-term action item that need to be taken for the city to give a sanitation services that is meeting the SDGs. So that is how you read the output from the assessment. I'm gonna pause here and go back to the presentation. Yes. Right. So I think many of you know how to read as SFD, but just to clarify, this is the SFD has a graphical representation that's an easy snapshot of the conditions of the sanitation for the city. That includes off-site, that is a sewage connection, and on-site, so you can see on the left, and then the open defecation. And the size of each will represent the percentage of the fecal matter that is generated, and the colors will depict the amount of percentage of fecal matter that is then going through each of the state service value chain safely, or that is green, or unsafely, that is red. So that's briefly how you read the SFD. CSDA offers the traffic light system of reading the report that includes the green, yellow, and red. As you might be, green indicates it has functional standard, the standard could be raised, well as red indicates there is little to build on, so it needs to start from the very basic level, and yellow being the intermediate. So once you click on each, if it is red, what are the next steps is highlighted also in the color code for both non-sewer and sewer sanitation, and the next immediate urgent action items, whereas that is more like next action, not so urgent action item by the intensity of the color. Well, with that, I would ask my friend Mitra to talk about the next tool that we have.
Thank you, Eva. And I know we have been moving back and forth, but that is also to our advantage to showcase how tools can come together. And it is not necessarily like one specific tool that addresses all the questions, right? So, but how do we make them work together? And when we saw the SFD and CSDA, it can be applied for a particular city or a neighborhood or even for a larger region. So, which means the flexibility is built in already. And what it shows, the SFD and CSDA brings the physical flow of a wastewater or sludge for that particular region and the reasons and why, like the CSDA maps out all of these. Now, pause for a minute and think about what, the sludge flows, the reasons behind it, but can we associate some cost to it, some finance to it, and proceed by asking questions like, who has access to these services now? So we saw the reds and greens, right? So where does the red go? Where does the green go? And or is it only serving the poor or the non-poor in that particular area? So by asking questions in terms of who has access to these services right now, whether it's low income or other categories, and how are they paying, and how much are they paying? Are they paying to the vacuum trucks? Are they paying to the manual emptiers? And what is the price that they're paying, and what are they paying to the sewage sanitation, sewage network as well? And who is providing these services, right? Once you have the SFT in mind, you will also have to think about how your services are going, who is providing it. By asking who is providing, we mean it could be a public authority, it could be a private sector, both a regulated or unregulated, and it could be a combination of any of these. And what is the cost to serve for providing these services? So this forms the basis of the assessment that we will have to take up in a particular environment or a particular service area. So we are continuing the aspect of SFD and using extrapolating the data and using additional data collection for creating a baseline in the Equiser, right? So what is Equiser? Equiser is also a digital platform, and it is used to operationalize Citywide's principles and spark questions about inclusive service delivery, right? So when we have seen this, the questions that were in the previous slide, it was talking about how the service delivery can be inclusive by asking who is served and who is providing the service and what it costs. So the fundamental fact for that is to start with a market system approach. So when we say market system approach, it could be the public service authority, who is mandated, who is responsible and accountable for it. And there is also the private sector that is operating in the same space, and the households. All of them have their own factors and they come together, and this is the market system. And it also allows you to think about various business models, tariffs, and the levers such as regulation and service delivery as well, along the infrastructure additions that you can make for a city to move from X percentage to Y percentage. And what it does, how it does, it allows you to compare plans and investments on three aspects. One is the equity, so a fairness in distribution, and safety in terms of the safely managed waste, safe coverage, etc., and sustainability in terms of financial sustainability and what is the amount of water that is being used, so in terms of environmental sustainability as well. So to quickly, because the tool can be usually, once you go into the tool, it can be overwhelming to have it in a short period of time. It is important to understand the data flow so that we are also thinking about how these tools are when you look at the interface itself, right? So when first thing is you have understood the coverage, right? So the coverage in terms of X percentage is off-site, X percentage is on-site, and so on, and Z percent is open defecation, and so on and so forth. Now we map that to the particular hardware, right? So when we say hardware, it could be a type of sanitation service segments in terms of whether it could be containment, it could be emptying and transportation, sewer networks, treatment plants, and so on and so forth. So the first question that we ask is, the input that is being done is in terms of containment, like what percentage of it is non-low income households, what percentage is low income households, and who delivers it. Or for example, in this case, it's a containment. In the containment, it could be either with subsidy or without subsidy. When we say subsidy, whether the utility is financing it or not, and what kind of hardware details that they have, like in terms of number of units, or the size of the units itself, and the cost associated with it, both in terms of the capex and the opex, and who is financing, how is it financed, and so on and so forth. So similarly, we could complete it for the other hardware segments as well, in terms of emptying and transportation, or it could be for the treatment plant. Just a quick moment. So, or for the treatment plant. So here, one way to also look about it is when we say that service delivery model for emptying and transportation, it could also have multiple utilities and regulators, utility and private sector both operating in the same space. So there are multiple service delivery at each segment of the value chain that is being mapped. And this is the data flow structure. So I will quickly move on to, this is the data flow structure. And if you see, predominantly it is divided into 8 components. Hardware choices, who gets the coverage in terms of poor versus non-poor. What are the service delivery model choices? How the coverage is converted into hardware, like the numbers. What costs are associated with it. The finances and the revenue or the tariff that is being paid as well, right? And at what rate it is being emptied, or the demand side itself. When we talk about Equiser, right, so it's a very straightforward framework that we operate in, right? So one is through creation of scenarios. You have a baseline. Now what we do with the baseline, once you have the baseline, you know the data, the assessment, and the utilities or the regulators or all the stakeholders can come together and understand what are the best, or where are we now and where do we want to go, and what are the various ways or what are the various changes that we want to make to a particular existing scenario. The tool framework is simple. It allows you to create scenarios using data input, and it has a back-end calculation that is for a 10-year period, and the outputs are projected. So the process is this: fill the baseline once, change the intervention data points, and execute it. Right? And most importantly, we are looking from a service authority point of view. Right? Again, we will come back to this, but still the outputs are in terms of equity, sustainability, and safety, and I will take you these when we are in the real dashboard itself. So I'm also going to use the pre-recorded video in the interest of time. So Equiser is available in www.equiserve.io. It's housed in that website, and the tool can be accessed through Get Started, and you have a sign-in option as a regulator, as a utility, or a staff. And once you have that, there is a city management dashboard that you have been creating. So here we have a pre-populated city dashboards that I've been using for over some years. And I'm particularly selecting a city that Eva was also looking at, the City A. Here we have conducted this City A assessment in Equiser. So the way that the tool starts, it starts with the city details, collecting the city details. What is the population? What is the population growth rate? Where is the baseline, and what is the target year? When we say the target year, it could be X number of years from the current baseline to compare how the growth is. We also look at the population as low income and non-low income households, and this could be the definition of low income and non-low income could be as per your city's definition, right? And then the tool allows you to go to the scenario section. So when we create scenarios, the first time when we are creating the tool, you will only have the baseline. You will subsequently create all the scenarios, and the tool automatically allows you to add a particular scenario as and when you go and make those changes. So and also the tool is available in English and French as of now. We would be doing it in subsequent languages, Portuguese and so on, later stage. If you see, there are 6 divisions in terms of sanitation system, which is also a value chain approach. And in this sanitation system, we have 4 broad sanitation system level, that is conventional sewer, non-conventional sewer, safe on-site, and unsafe on-site. And we have emptying and transportation. So the emptying and transportation is again divided into vacuum truck or the manual emptying. So here what we do is what proportion of your particular safe on-site is being emptied by a particular vacuum truck or a manual emptying. So these level of data are entered as a percentage of your containment, and subsequently you would get a particular, this is more of an SFD kind of approach as well, but with predefined typologies of the sanitation system. So what proportion of the emptied and transported reaches either a wastewater treatment plant or a fecal sludge treatment plant? Here, we are not subscribing to one particular technology. It could be anything, as long as you are able to identify and associate cost with it. And whether the city or whether the service area has got reuse, and what proportion of your treated sludge is going to the reuse. And next is the important part where the service model is added. So even for the value chain, it is added in similar ways. So you can see here different service models are being chosen. It could be utility, regulated, unregulated, and private. And why does it matter? It matters because what costs are associated with it is, and what price they pay to a particular service provider is important here. And we subsequently choose other service model as well. And here are the hardware choices that we are going to go. And all of these, from the containment to reuse, follows a similar pattern in terms of hardware details, demand details, CapEx, OpEx, and source of finance. It is kept similar so that the user has got a recall value and are able to fill in the details very subsequently. in hardware, we cover what percentage, convert that percentage into numbers, like what kilometer of pipeline. In the demand, you see there are different types of tariffs for a conventional sewer that are predominant for a particular city. You can choose whatever tariff system that is available in your city and be able to fill in the details for the low income, the non-low income, and industrial and commercial. And we also have options to add non-volumetric revenue sources as well. In the CapEx, we have the last mile connectivity and whether it is financed by the utility, and also we have the line by line item of your CapEx. So one option is if you do not know the line by line costing, you can also have the option of bulking it together. So this is also somewhere you can, depending upon the level of data that you are having, you can choose to work on it. And the tool also covers the extraordinary repairs because it's a life cycle approach. You have the extraordinary repairs, the depreciation, and the interest liabilities that are currently bearing on the utilities. So moving on to the OpEx details, right? So the OpEx details, today the plant or the sewer network could be operating at a particular cost, but they might have to move to an optimal cost. So the optimal cost and the current cost of operating is captured, and also the year at which the optimal cost kicks in is also captured here. And why is it needed? Because you are projecting for a period of 10 years and you might want to be very specific where does it go. And finally, there is a source of finance. So because in most of the cases, the sewer component and the on-site components could be managed by different entities within the city. They are treated as a separate business model with separate sources of finance and separate P&L. But in reality, it could be either the combined statements, financial statements as well. So when we say financial statements, so here we are identifying the cost separately, we're identifying the source of finance separately as well. So all the subsequent sections are also following the similar pattern in terms of hardware, demand, CapEx, OpEx, and source of finance as well. So when we move to the safe, so here we see that the data is not available in detail for a decentralized system. So what we do is we lump it together and say this is the total cost per kilometer or total cost per unit, and then be able to work on it. So this is also used a case where certain level of data is missing, and you can do with estimates, but this is not necessarily always the case, and you can go and revise the estimates and do a detailed planning or review itself. Here in the on-site, you can know either the number of units. You might not know how much septic tanks that you have in a city. So you can alternatively go for a once in X number of years, so on and so forth. So here, what is happening is you're also filling in the frequency, the cost for the containment, and who is financing it, and so on and so forth. And similarly, we would be moving on to all the reuse system as well. So here also I'm trying to jump to a particular place. So it doesn't allow, just a second, in the interest of time. So we have been seeing this. It starts from the beginning, right? Okay, let me check. Okay. This doesn't allow to come to the end point. Okay. Let me quickly come to the dashboard itself and then take you from there. Escape doesn't work. Okay. That's right. Okay, so what happens with all of these inputs that we put in, right? So these inputs have been useful in identifying the entire sanitation system, and now we have said that we would be mapping it against equity, safety, and sustainability. So how does that look in terms of the dashboard? Right. So the dashboard here, I will also go into the tools shortly, but here the dashboard view is in such a way that it is laid out horizontally, and the scenarios would be stacked vertically. So here what we see is the baseline that is being, it's a screen capture, so some loss of quality might be here in terms of the image, but however, the service segments that we have are the sewer, non-conventional, safe containment, and unsafe containment. And there is service coverage. So the service coverage is the coverage of the city, and we will be able to see how much of the service coverage between sewer, non-conventional, safe, and unsafe, and this is provided as percentage of safe coverage. If you see the market structure, we have identified the market structure at each stage of the value chain, and this is presented here. And why is this important? This is important to understand how the public expenditure, or where the spending is going, and who is it going to, right? So this is mostly to make it as a point of reference as well. So then we also have the public expenditure life cycle cost. The public expenditure life cycle cost is nothing but our CapEx and the 10-year OpEx that are used or that are spent from the public exchequer to a particular system. It could be the sewer plus WWTP, or it could be the decentralized plus FSTP, or it could be the containment plus FSTP. As long as these are public spending, this is being allocated. So what we see, the blues and reds, right? So the blue is nothing but your low-income households. The reds are your non-low-income households. And when we are reading this dashboard, we will have to be mindful in terms of the entire bar could be the total amount, but how is it divided between the low income and the non-low income households is of interest to us, and also how it is divided between different segments. So there are multiple components you might want to think about. So who gets the service in terms of blue or red? Where is it going, whether it's on-site, off-site, and so on and so forth, and where the spending is in, right? So here we see that the sewer households are the ones, even though they are less than 20 or less than around 21% or 25% of your city, they get about 80% of your public spending. And predominantly, if you see the red portion, the red portion denominates the non-low income households, and they are getting the public expenditure. So which in essence talks about the inequity in spending. The safe on-site or the unsafe on-site households do not get as much as spending that has to be there. And once we are looking at an equity from a public's point of view, that is a service authority's point of view, what is the equity in terms of the household? Whether the households are spending commensurate to the services that they receive. For example, here the households are serviced by private sector market, and they pay higher sometimes in cases than in some of the sewered households, and this what we represent here is an average annual household expenditure. Also, if you see that the unsafe households in the low income households are the ones that are paying higher because they are choosing manual emptying compared to a vacuum truck emptying that they don't have access to or they will not have access to, and predominantly unregulated. The cost coverage here represents the profit or loss for that utility, and what percentage of your cost is covered by the revenue that you generate in terms of direct revenues, in terms of billing and collection, or the indirect revenues in terms of tipping fee or other sources of revenues that you have modeled for or you have in that city. And the total government's cost is nothing but what amount of transfers and the subsidies, operational subsidies that are available for that particular city. So we see that the operational deficit is still high, And also we map from a sustainability point of view the water requirement for each of these particular segments. So why is it important? Because it is to show that if you are at a particular water constrained area and the amount of water strain that you are putting on your system is important to understand where do we want to spend our resources in the sanitation sector itself. So are we water rich, water deficit, and how do we plan our sanitation system around it is also important. And finally, the waste safely managed is an SFD light approach that is subsequent system, that is containment to reuse is captured at each of sewer, non-conventional sewer, safe and unsafe, and it is also in the form of a heat map, right? So I will move on. We will move on to the planning. So we have covered the assessment part of it. Now, once you cover the assessment, what good looks like, right? So you know where we are, but what good looks like? So where are the pathways? What are the pathways and interventions to support these goals? And which of these business models can be prioritized to achieve those goals? And I will request Eva to take on the infrastructure planning and the business model selection tool.
Right. Okay, so we saw from both the Equiser and the SFD and the CSTA that for City A, the concern was in the lack of emptying options that were present for the City A, so that is emptying trucks or transport systems from the non-sewer sanitation system to a treatment. And also we saw that 11% of sludge that was reaching the treatment that was not treated. So it's both the transport and containment and also the treatment option. So these are the gaps that we identified through our SFT and CST, and the enabling environment was captured through a CSTA. And also we saw what was the current spending expenses equity through the Equiser. So with that understanding and looking at City A again of what it currently has, what is the next steps for the next 5 years for City A? How can it improve its sanitation situation? So we have given an attainable goal here as an example, that they want to increase the safe coverage by at least 11%. And they want to also do this by improve the safely managed waste in the city. And so they plan this intervention by having a certain amount of sewer system that they want to increase, have more couple more treatment plants, a fecal sludge treatment plant, also have a better service delivery that is no change, but also improving more business models that could serve the current existing and also the future needs for the city. And to achieve this, I'm going to go through the infrastructure plan, which here will talk about the building of the treatment plant that both mainly are looking at the FST piece. So as a tool, the planning tool takes you through, it's a survey-based tool. So here first, you look at the questions of what are the different infrastructure that is lacking, and then you select the one that you want for the city. And here we have selected treatment plant size estimation for the city. And then once you select, you also get a certain question that's relevant to your needs, and that includes the basic city information, and also then go on to what is the current city level dislodging rates, or what are the growth rate for the city, what are the residential versus non-residential, like floating population. So all these data is fed in as per the city details. And then with this basic data about the City A, then we have the survey aspect, so where we ask the surveyor to go through each of the wards or the zones and identify not only the locations, but also identify the current existing like soil condition, what is the water level depth, slopes. So various details about the site that is selected is identified and surveyed, but not, and also for example, I'm going to pause here. Example, if there is also toilet infrastructure to be built, or if there were the vehicle procurement part to be built, the survey questions will also include those needs. But since here we are talking about the infrastructure for just the treatment FSTP building, most of the questions, the survey questions, are directed towards that. And with that, the next step would include, of course, what is available, treatment options. Would the people use the reuse products that is coming out of the treatment? So all of this need to be planned in before the infrastructure is selected for the treatment option and then built. So once we have the survey plan ready and the surveyors go out, here just a snapshot of how the data is collected and how it is seen at the back end by either the planner or the utility, like how much of your survey has been completed. You upload your map. Sorry, you can't see the map very clearly here, and also since it's an example, we didn't have like very detailed map, but then also within the map you plot out the various infrastructure here. Just to clarify this one, I've taken a separate example. Sorry, the videos are not yeah. Okay. Yes. No. Oh, yeah. Right. So to give you an example, because we couldn't do the survey for city A, I'm taking an example of the surveys that we conducted for another city and showing you how from the back end it will look for a person planning or for a utility or a municipality's planning. There is certain data that you need to enter that includes the map, the survey data is collected from on site, but then also there's assumptions that is very relevant to your city. It might not be here. It's for toilets, seats, particularly like how many numbers male to female ratio that is entered, but then also there is the assumptions in terms of sludge accumulation rate, etc., that is relevant to your building of transport. How often the emptying service need to be, and how much sludge is produced in this particular city that need to be treated. So with that, I'll just continue the video. So we have the assumptions entered, and then once you have completed your survey, entered your assumptions, you get a report that gives out detailed map of like along the value chain. If you have selected, for example, in this particular example, which is different from city A, is showcasing along the value chain, not only treatment, but also household toilet construction, public toilet construction, vehicle procurement, treatment infrastructure, and if there is existing treatment infrastructure already, how much of it could be used from cross-utilized as a region that is close by to the city's needs. So then we get the output in form of like maps, because it also uses geolocation and so land availability that is needed. So you can see using this example of like what is the available households with toilet, that with the ones without toilet, the one that has land for construction of toilets, that needs to use community toilets that is close by. Here's the community toilet and public toilet construction as well. So, and mobile toilets. So then this next is the public toilets. If that was one of the questions that we were doing for the city, the surveys will be done of what is existing public toilets. Is it serving the public, the population, the floating population that is within the city? If not, what are the areas that is available that we could do? We could construct more public toilets, and how many number of people will it serve based on the calculation and assumptions we already fed into the program algorithm. So that then. Brings us to the emptying. Yeah, so, why is it not playing? Yeah, okay. And then the next, we showcase the vehicle procurement. Is the current sludge that is generated by within the city is sufficient? And we use the two methods here. One is through the survey, like so the volume of on-site sanitation, the sludge that is accumulated on-site sanitation based on the survey and the total number of emptying that occurs. And then there's the sludge accumulation method. So as a utility or municipality, you can take the average of both, because one of them takes the small sample size case and the other one is also based on the calculation that is used. So that gives, if you need more trucks or if you don't need more trucks to do the emptying, and then this would also then lead to the business models that you need to select. Okay, yeah, this is the sludge accumulation method. Both for access to good roads and not access to good roads, the different types of containment units, which also has different emptying cycles, and the volume is calculated using the how much sludge is accumulated and how much is there then therefore needed to be emptied per year, and then per day, what is the rate at which we need to empty and the volume that needs to be emptied, and that gives us the number of trucks that is needed. So that is the vehicle procurement. Yeah, and then we go to the next part, which is the treatment options. What is the local treatment infrastructure that is required? And so here the output is based on the conditions of the groundwater, the local land conditions, availability of water, availability of electricity. Is the city comfortable using energy within the treatment options? We come. Is it not playing? Sorry. It's not just playing. Anyways, I'll just explain. So along the value chain, so we have different kind of on-site systems that are suitable for the area. So it'll start with, it could be a sludge drying bed, it could be like a septic tank option, or if it is treatment, the transport option, what is the next available? Yeah, what are the best option that is available that's suitable based on the condition that I mentioned about before, and also the secondary, tertiary treatment, what are the reuse possibilities that are available. So there's like different options that based on the technologies that are currently available are presented. And then it is up to the utility or the municipality or city to come at a decision of like, let's see what is financially possible for us, what is the technology that we are most familiar with, what is the O&M that we can do, and the energy that we can put into that electricity, water, whatever it be, that we can afford to, that we can use for the system. And then when you generate byproducts after the treatment, who will use it, and how much will it take for us to, is it the best case for us for the city A? And so giving the planning tool gives us those options for the treatment, and then it's up, the discussion that follows after could be based on these estimates that is given. Sorry, the video is not playing. So the next option then is coming to the cross-utilization. So here there is, for example, there is an existing wastewater treatment plant, and then how close is this wastewater treatment plant to the regions that need to use empty and that needs emptying services, and the closest ones to the region that needs, if there is a wastewater treatment plant, can it already be utilized for this purpose? Is the volume sufficient? And if not, is there one that is closest, that is a FSTP, and if not, if there's one that is next to in a nearby city that could be used. So all of that is calculated based on the how much, how long, what is the distance, the volume availability, and also the technology that is currently there. So then that is the output from the planning tool. Like I said, the workflow is like so. It just, yeah, it showcases you start with preparing the questionnaire. That is, we have a set questionnaire. You can also add and edit based on your local needs. Then you determine what the sample steps are, sample sizes. You need to train the people who go out into this, go out and do the survey. Then you get the data at the back end, do the analysis, and part of it is mobile application where the enumerators go to the field and get the data. Then the report gives you a starting basis for the next discussions that need to happen for infrastructure planning for City A. So that is how you work with the enumerator, like somebody who's preparing the questionnaire, setting up the infrastructure planning survey. Enumerator gets it on their phone, goes outside, asks the questions, gets the data. The utility or the person who's doing the planning gets the information at the back end. Like I said, there are certain assumptions that needs to be, it's very case specific and very region specific. Here's an example for the one for the toilets. But yeah, these gives an output along the value chain that can lead to the next set of discussions that need to take place in terms of what is affordable and what is feasible for a City A. That would bring me to, I'll give Mitra.
What we saw in the planning tool, our infrastructure planning tool, gave us an opportunity to think about what infrastructure are the best solutions and how do we go about it. So it's nuts and bolts and the design of a particular improvement plan that you want to make. But when you are sitting back, take a look back and think about, are there only one pathway, right? So the infrastructure planning is so very important to understand what is doable, what is not doable in a particular context, and to be able to use that information and talk to the policymakers or the regulators or the utilities or the multilaterals and think about what do I want for my city, right? So interventions to model beyond infrastructure when you are doing a service planning is more than the hardware. So when we say more than the hardware, within the hardware, just addition of infrastructure alone is not the solution. So in Equiser, you can do by iterating different inputs as interventions. So it could be as simple as, you don't have to add infrastructure, but could be can you repair or build or face it differently so that you are able to see a different output or different cost or the C-wise outcomes that you are looking at in your dashboard. Could be capacity utilization and efficiencies, owning, leasing, and outsourcing. So the tool allows you to operate or iterate between all of these depending upon what is your requirement is and what your imagination is, right? And the indirect and soft costs in terms of what additional indirect cost would you incur. For example, if you are adding a hardware like a connection, last mile connectivity, there are indirect costs that goes into it in terms of how do you propagate, how do you make sure everybody is connecting to it, or if for a planning, it is one thing to plan for a larger infrastructure, but it is a different thing to plan for the last mile connectivity or a particular containment. So how do you incorporate all of those costs? And in fact, you have to add all of those, right? So the hardware portion of it, or it could be revenue model in terms of there are fixed variables, fixed and variable charges, revenues, direct and indirect, whether it is associated with a particular flow or volumetric, or it is indirect revenues, or it could be whether it is ring fence, or is it a sanitation levy that you are ring fencing for proper interventions, and whether it is flat or volumetric, depending upon how your water sector is also, and connecting it to your the existing sanitation sector as well. And how do the households contribute to each of these revenues as well, in terms of whether is it to a private sector, or whether it is to how it is paying to a reuse product, and so on and so forth. Once you have covering the hardware and revenue, you could also think about regulation and policies. So why are we presenting this? This is more to think about different levers. So as and when you are looking at it, you can think about it as different options that you can consider for modeling, or to change the needle from one place to the other. The regulation and policy includes like ease and cost of doing business. So there could be inputs that you can change to do the ease and cost of doing businesses, and the performance incentives and disincentives in terms of regulation and market organization. So what happens if a public sector enters in emptying and transportation? Are the markets organized? What happens if there is a subsidy, toilet subsidy, emptying subsidy? Are the markets organized, or any of these? How do they participate? Right. So those changes are also can be captured as one of the intervention. And of course, there could be procurement and finance, which is larger part of your how the public finances are being spent in terms of how do you procurement policies are, how the finances and the source of finances are, the SLAs associated with it, and the policies in terms of the subsidies, and what is your budgeting plan is, what is your budgeting capacities are, and how reliant are you on your central government transfers, and the cost itself, right? What does it cost? Are you going to take a costly, expensive loan that is going to be repaid or not repaid, and how does that affect your performance? So while doing this, right, what good looks like, say, because Eva took us through the infrastructure and told what infrastructures would look good and what is the ambition for that particular city. So when you link your ambition to your particular city and say what good looks like in the next 5 years in a service delivery approach, right? That was related to how a percentage coverage has to be increased, but that is still valid, and it is valid, but we might want to see, can there be an additional increase in safe coverage? Can we improve safely managed waste even better? Can there be public allocation to poor that is improved? And of course, there is no additional strain on the water usage, right? So the interventions planned are also very, very aligned to this in terms of, can we subsidize toilet construction? And what about the MTS being regulated? So these are some of the examples. These are not necessarily the entire gamut. You would have multiple interventions based on the location, the condition, the operating and enabling environment as well. So the city goes on. Which intervention did the city add? Right. So which means they added the revenue model, that is, so let me start with how they started on procurement and finance. They subsidized toilet construction for the most vulnerable population, the identified poor population, and also they started regulating the vacuum truck emptiers, but not the entire one, but at least a portion of it. So about 50% of the city had an overseeing or a regulation or a policies that also led to some amount of price control. And what happened is there was some source of revenue that came in as well through in terms of the indirect revenue, in terms of how could they charge the regulated private sector a little bit so that the revenue is also flowing in. So all of these are changing, and how do you model it in your Equiser tool? So the tool is only a means to an end, right? When we say the tool is means to an end, what it means is that you, as a city or as a utility, you have planned, you have interventions that you have thought of, which will take from okay to good to better, right? But what happens? How do you compare? How do you know which is the better one, right? So for that, you need to do an iterative modeling, right? The iterative modeling should come from set of interventions that you have already decided on. So let me quickly walk through of all the city dashboard that we have already seen as a baseline. So this is how it looks like in the dashboard when you are doing only the baseline. The tool allows you to go back to your scenario entry, and then you can add new scenarios. So it's just a copying of your baseline, and go and do your changes that you wanted to do. So here we are doing a hardware-only change. So what are we doing in a hardware-only change? We are saying that so about 10% of your population or 11% of your population which are on-site are moving to sewer sanitation. What happens if you're going to do that? And which means you are changing the coverage. In this tool, you will just change the coverage and then change the relevant hardware, right? So here the hardware is sewer network, right? So from an existing 132 kilometers over a period of 3 years, the change happens on the final 180 kilometer of pipeline is being constructed. So you make the change. There are no other changes that you have planned for, but you can do it at a later stage if you want to. And of course, we are adding to additional wastewater treatment plant to serve the additional wastewater that is going to come in, and the size is very dependent on the what the infrastructure planning tool had highlighted on. And similarly for the fecal stretch. So now what if we combine the hardware with equity? When we say equity here, it means you are doing some pro-poor interventions. The first pro-poor interventions that is being done is to move the unsafe containment to safe containment. How does it happen? You are partly providing subsidies, toilet subsidies, and especially targeted at poor, and then making them to move to a slightly better or a better containment that they can construct. Here you also have to think about what the service delivery model changes are. So what happens is no longer the service model is only by households, it is shifting to households with utility financing as well. So the corresponding changes we do are what percentage of your particular type of containment is being changed, and what proportion does that utility is going to finance. It might finance the 100%, or it might finance only a portion of it. When we say finance, it could be subsidy, free, or it could be coming with a cost. And next iteration that we do is hardware and equity with regulation. So we have touched upon the hardware in terms of conventional sewer. Now we are moving, and also the toilet subsidies. What happens if you do some regulation? Here we straight away go into the emptying and transportation, change the service model. And if you see here, earlier the trucks were only in terms of unregulated. Now a portion of it is moving to a regulated services, right? So the about 50% of your city has got regulated trucks as well. So the price that is being paid by a regulated versus an unregulated, there is a small difference, but it's still a difference, right? When you do it in a per volume metric, per meter cube, or per trip. So we are not doing other changes. We could do multiple changes. So for example, if you are with the regulation, there could be, or with the toilet subsidies, there could be more emptying that is happening. So what happens is your safe coverage increases, and also a safely managed waste increases, right? So this is the dashboard, and here we are, for the purpose of this, we see how the safe coverage moves, right? So safe coverage moves from 72% to 83% just by virtue of adding sewer lines, and it does not change any of your service model. There is an hardware and equity. In the hardware and equity, the 83 is getting bumped to 88%, but this is by virtue of this toilets, that is unsafe toilets, moving to safe toilets, right? And we remember that we had financed those, and those are moving to a safe containment, and that is right now at 88%. But if we have the intervention on regulation. At least in this case, what happens is we have not touched the safe coverage portion, but the safely managed will definitely change. So what happens is with the regulation, we see the safe coverage is still there. So what does it give? It gives us different comparative scenarios and the associated indicators in terms of safety and sustainability and equity as well. So let's move on in terms of how does it change the market structure. The market structure is not changed in the second one. If you see, U plus R is nothing but your both coexisting. I'll take a minute to show that when you are reading, the way that we will read is each of the value chain is marked either as a U, which means unregulated, R is regulated, U plus R is unregulated. So from first to second, there is no service delivery changes, but when you are looking at the third and the fourth scenario, in the third scenario, the toilet structure service model changes, whereas in the fourth one, that is hardware equity and regulation, your emptying and transportation or that service chain also changes its market structure. And why is it relevant? Because it's useful to think about how the costs are panning out, right? And if you were to compare the public expenditure, of course, the public expenditure on increasing your sewer network would increase from your baseline. We see that there is an increase in the sewer spending in the hardware only portion, and it is at least twice of it. And what we have done, what we see is that there is not much, or there is only a small portion of the money, public money, that is going into the on-site sanitation, right? But if we were to do the intervention in terms of equity or equity with regulation, you see that the 3.535, that is the safe containment and the unsafe containment, increases the public spending on that, increases slightly because of the toilet subsidies and the regulation and the cost associated with this. So we are not saying that the one thing that we are trying to keep or take away from this is, where is your public expenditure targeted at? Are they targeted at the poor, non-poor, which service segment? And moving on, we have the average annual household expenditure. If you see that the average annual household expenditure are not going to change much for the sewers, because we are not changing other interventions in terms of the density or the number of households that are getting connected to a particular connection and so on and so forth. But what we did was we moved or we brought in few or at least 50% of the MTS to regulated. So what it means, the households that are choosing those MTS would be paying less, right? So similarly, if you are to bring in manual emptying into regulation, if you make sure that all of them are regulated, or if you were able to directly or indirectly bring some form of control or at least an overview of the price, the household expenditure might be different. I'm not saying it could be higher or lower, but it could be more. It could be different from what it is. The cost coverage again shows us the utility is still not making the profit because we have not touched the tariff, and we are not touching. We have just increased our sewer connections and the sewer lines and the number of connections. We have also added infrastructure, and that might still not be cost recovery at this point of time. So what do? We have to make sure how are these going to be cost recovery or not, depending upon whether what additional changes that we would want to. Do we want to have a tariff reset? Do you want to make more emptying and make sure that the FSTP is being paid for, so on and so forth. And we do see that the water requirement, again, it's a comparative water requirement, and the waste safely managed is also something that we would be comparing between different value chains. So this gives you a snapshot of all the scenarios across different outcomes. But what do we do with this, right? So it is only useful when you are comparing it with a particular indicator, and we are able to guide it by a decision making, right? Here we are comparing how the increase in safe coverage changes, and we just ran through this and see how the household expenditure changes. So this helps you to think about which of the scenario you would want to proceed with, or a combination of this, and then incorporate it in your planning, right? So with this, we have come to the end of the planning process. And in the planning process, the takeaway, right? So the last takeaway that we have is there could be multiple decision pathways that you can take and model it for, and be able to think about alternative scenarios. Once you have these alternative scenarios, you also be able to get a guided decision. So some of the recent deployments that we have made are in different cities, and one of the, and in the interest of time, we also want to think about the key takeaways, right? So the key takeaways are the utilities can take up these tools for free and is available for sign up. The peer learning and guidance is possible, and it is done in different cases. And there are a variety of use cases in terms of strategic plans, implementation plans, tariff reviews, and performance improvement plans. So it's not only the service plans, but there are multiple use cases for it as well. So moving on, if Elizabeth is online, I would invite her to give a quick snapshot on the framework that ESAWAS is putting into practice, and then wrap up the session for us for questions. Elizabeth? Okay. Right, and I think Elizabeth is offline. So what we have done, what ESAWAS has done is in the different countries, right? So she's online, yeah. Elizabeth?
Yes, please.
Now it's your closing remarks on how ESAWAS is doing. Please do the needful.
Oh, thank you. Thank you very much. Yeah, with regard to framework implementation, ESAWAS currently have 12 members. They have not yet all taken up the framework, but at least they have appreciated the need to focus on both seaward and non-seaward sanitation. Because when we talk about citywide inclusive sanitation, we are not advocating for either seaward or non-seaward. We are looking at the sanitation services that covers everyone, that reach everyone. So Kenya, Tanzania, Burundi, and Rwanda, they have been able to take up the framework. They have made stakeholders consultation for operationalizing the regulation framework. They have the strategy and the framework for inclusive sanitation has been adapted to specific country context. They have also developed national roadmap for citywide inclusive sanitation implementation. And a number of countries like Burundi, they have reviewed, they developed the water and sanitation law, which incorporates on-site sanitation, which was previously not there. Tanzania and Rwanda, they have developed guidelines on fecal sludge management and on-site sanitation. Uganda, they have integrated the tool, Equiser tool, in overall sector planning to guide investment, the target groups, and also resource allocation. Kenya, Tanzania, and Uganda, they have already implemented the tool in some cities, and now they are at the stage of upscaling to other cities. Rwanda, Burundi, and Mozambique are onboarding very, very, very soon. And other countries are also planning to take up the use of the tools. And in all, we have also emphasized the peer learning, because ESAWAS believes that our members are at different levels of regulation and implementation of the framework. So we encourage peer learning, where a country or a city or a utility can learn from another peer from another country to learn for good practice what can be applied in the specific context. So what are the lessons learned for citywide inclusive sanitation to be effective?
Elizabeth, I'm just going to cut
Yes,
you there. We are running over time. Thank you. I think many of us them can see the lessons, but thank you. I'm going to cut it here. Once again, we're sorry for the very intense 1.5 hours. You can reach out to us for question and answers, but we are over time, so we're not taking many questions here. We're also available here outside if you want to for the rest of the conference. Thank you, and thank you for listening to us. Thanks.